Okay, I'm going to be talking about sickle cell anemia. My name is Jay Jones. What is sickle cell anemia? It is a serious condition in which red blood cells can become sickle shaped. Normal red blood cells are smooth and round. They move easily through blood vessels to carry oxygen to all parts of the body. Sickle shaped cells don't move easily through the blood. They're stiff and sticky and tend to form clumps and get stuck in blood vessels. The clumps of sickle cell block blood flow in the blood vessels that lead to the limbs and organs. Blocked blood vessels can cause pain, serious infection, and organ damage. So this is what a normal red blood cell looks like on the left. Um, the inset image shows a cross section of a normal red blood cell with normal hemoglobin. And on the right, we have a sickled red blood cell in the blood vessel. And as you can see, they're bent. They're not round and they're not as dense as the normal red blood cell. The inset image shows a cross section of a sickle cell red blood with abnormal strands of hemoglobin. Sickle cell anemia versus sickle cell trait. Um, the sickle cell trait, people who have sickle cell anemia is an inherited lifelong condition. People who have sickle cell anemia are born with it. They inherit two copies of the sickle cell gene, one from the mother and one from the father. People who inherit a sickle cell gene from one parent and a normal gene from the other have a condition called sickle cell trait. Sickle cell trait is different from sickle cell anemia. People with sickle cell trait don't have the condition, but they have one of the genes that causes the condition. Like people with sickle cell anemia, people with sickle cell trait can pass the gene on when they have children. So why is it called anemia? Anemia is a condition in which a person's blood has a lower than normal number of red blood cells, or the red blood cells don't have enough hemoglobin. Hemoglobin is an iron-rich protein that gives blood its red color and carries oxygen from the lungs to the rest of the body. Normal red blood cells last about 120 days in the bloodstream and then they die. Their main role is to carry oxygen, but they also remove carbon dioxide, a waste product, from cells that and carry it to the lungs to be exhaled. In sickle cell anemia, a lower than normal number of red blood cells occurs because sickle cells don't last very long. Sickle cells die faster than normal red blood cells, usually after only about 10 to 20 days. The bone marrow can't make new red blood cells fast enough to replace the dying ones, and the result is anemia. So, who is at risk? Sickle cell anemia affects millions of people worldwide. It's most common in people whose families come from Africa, South or Central America, Caribbean islands, Mediterranean countries such as Turkey, Greece, Italy, India, and Saudi Arabia are also countries that usually are affected. In the United States, sickle cell anemia affects about 70,000 people. It mainly affects African Americans, with the condition occurring in one in about every 500 African American births. Hispanic Americans are also affected. The condition occurs in one out of every 1,000 to 1,400 Hispanic American births. About 2 million Americans have sickle cell trait. About 1 in 12 African Americans has a sickle cell trait. So in the United States, with an estimated population of over 270 million, about 1,000 babies are born with sickle cell disease every year. That's all what I just said. About 2 million Americans have sickle cell trait. About 1 in 12 African Americans have the sickle cell trait. Signs and symptoms. The signs and symptoms of sickle cell anemia are different in each person. Some people have mild symptoms, others have severe symptoms and are often hospitalized for treatment. Although sickle cell anemia is present at birth, many infants don't show any signs until after 4 months of age. The most common signs and symptoms are linked to anemia and pain. Other signs and symptoms are linked to some of the complications of the condition. Um, So the general signs and symptoms of anemia are fatigue, pale skin, and nail beds, jaundice, and shortness of breath. Sudden episodes of pain throughout the body are a common symptom of sickle cell anemia and are often referred to as sickle cell crisis. A sickle cell crisis occurs when the red blood cells sickle and stick together in clumps. The clumps block the flow of blood through the small blood vessels or capillaries and the limbs and organs. Sickle crisis can cause acute or chronic pain. Acute pain is the most common type. This is the sudden pain that can range from mild to very severe. The pain usually lasts from hours to a few days. Chronic pain usually lasts for weeks to months. Chronic pain, it can be hard to bear and mentally draining. The pain may severely limit daily activities. Almost all people with sickle cell anemia have painful crises at some point in their lives. Some have a crisis less than once a year. Others may have 15 or more a year. Such many factors can contribute to sickle cell crisis. Often more than one factor is involved, and the exact cause can't be identified. Factors that occur in your body and aren't under your control can cause a sickle cell crisis, such as an infection. Factors that you can control also can affect whether you have sickle cell crisis. You have a sickle cell crisis. For example, dehydration, when your body doesn't have enough fluid, it can increase your chances of having a sickle cell crisis. Drinking plenty of fluids so your body can stay hydrated can often help decrease the chance of a crisis. The most common sites affected by sickle cell crisis are the bones, lungs, abdomen, and joints. The blocked blood flow can cause pain and organ damage. Here are some complications of sickle cell anemia. Complications of sickle cell anemia come from the effects of sickle cell crisis on different parts of the body. So hand-foot syndrome is when sickle cells block the small blood vessels in the hands or feet. Pain and swelling along with fever can occur. One or both hands and or feet may be affected at the same time. Pain may be felt in the many bones of the hands and the feet. Swelling usually occurs on the back of the hands and the back of the feet, on the top of the feet, and it moves from the fingers. It moves between fingers and toes. This may be the first sign of sickle cell anemia in infants. Splenic crisis. The spleen is an organ in the abdomen that filters out abnormal red blood cells and helps fight infection. Sometimes the spleen traps many cells that should be in the bloodstream, and it grows large. This causes anemia. Blood transfusions may be needed until the body can make more cells and recover. If the spleen becomes too clogged with sickle cells, it can't work normally. It begins to shrink and stop working. As far as infections, both children and adults with sickle cell anemia have a hard time fighting infections. Sickle cell anemia can damage the spleen. It can cause damage to the spleen. Infants and young children with a damaged spleen are more likely to get infections that can kill them within hours or days. Pneumonia is the most common cause of death in young children who have sickle cell anemia. Meningitis, influenza, and hepatitis are other infections that are common in people with sickle cell anemia. Acute chest syndrome is a life-threatening condition linked to sickle cell anemia. It's similar to pneumonia and is caused by an infection or by sickle cells trapped in the lungs. People with this condition usually have chest pain, fever, and abdominal chest and an abnormal chest X-ray. Over time, lung damage may lead to pulmonary arterial hypertension. Children with sickle cell anemia often grow more slowly and reach puberty later than other children. A shortage of red blood cells, which is anemia, causes the slow growth rate. Adults with sickle cell anemia often are slender or small in size. Sickle-shaped red blood cells may stick to the walls of the tiny blood vessels in the brain. This can cause a stroke. This is a type of stroke. This type of stroke occurs mainly in children. The stroke can cause learning disabilities or even more severe problems. The retina, a thin layer of tissue in the back of the eye, takes the images you see and sends them to your brain. When the retina doesn't get enough blood, it can weaken. A weak retina can cause serious problems, including blindness. Males with sickle cell apnea, excuse me, males with sickle cell anemia may have painful and unwanted erections called priapism. This happens because the sickle cells stop blood flow out of an erect penis. Over time, priapism can damage the penis and lead to impotence. Excuse me. You may pee on yourself or go to the restroom on yourself. Excuse me. When red blood cells die, they release their hemoglobin, which the body breaks down into a compound called bilirubin. When there is too much bilirubin in the body, stones can form in the gallbladder. Gallstones can cause steady pain that lasts for 30 minutes or more in the upper right side of the belly, under the right shoulder or between the shoulder blades. This pain may come after eating fatty meals. People with gallstones may have nausea, vomiting, fever, sweating, chills, clay-colored stool, or jaundice. Sickle cell ulcers usually begin as small, raised, crusted sores on the lower third of the leg. Leg sores occur more often in males than in females and usually appear between the ages of 10 and 50. The cause of leg ulcers is not clear, but the number of ulcers can vary from one to many. Some of them heal rapidly, but others persist for years to come back after healing. Pulmonary arterial hypertension. This is high blood pressure. Damage to small blood vessels in the lungs makes it hard for the heart to pump blood through the lungs. This causes blood pressure in the lungs to increase. The condition is called pulmonary arterial hypertension. Excessive shortness of breath is an important symptom linked to this problem. Multiple organ failure is rare but serious. It happens when a person has sickle cell crisis that causes 2 out of the 3 major organs, lungs, liver, or kidney, to fail. Symptoms linked to this complication are a fever of Symptoms linked to this complication are a fever and changes in mental status, such as sudden tiredness and loss of interest in your surroundings. So how is sickle cell diagnosed? Early diagnosis of sickle cell anemia is very important so that children who have the condition can get proper treatment. In the United States, 44 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands now test all newborns for sickle cell anemia. In the other 6 states, you can request a sickle cell test. The test uses blood from the same blood samples used for other routine newborn screening tests. It can show whether the newborn infant has sickle cell anemia or sickle cell trait. If the first test shows some sickle cell hemoglobin, a second blood test is done to confirm the diagnosis. The second blood test looks at how the hemoglobin moves in an electric field, a process called electrophoresis. Sickle hemoglobin, it moves differently than normal hemoglobin. So electrophoresis is usually used to diagnose older children and adults. It is also possible to identify sickle cell anemia before birth. This is done by using a sample of amniotic fluid or tissue taken from the placenta. Amniotic fluid is the fluid around the sac. It's the fluid in the sac surrounding the growing embryo, and the placenta is the organ that attaches the umbilical cord to the mother's womb. And this test can be done as early as the first few months of pregnancy. It identifies the sickle gene rather than the hemoglobin it makes. Treatment. So mild painful crisis can be managed with treatments such as over-the-counter medicine and heating pads. However, severe pain may need to be treated in a hospital. Painful crises are the leading cause of emergency room visits and hospitalizations of people with sickle cell anemia. The usual treatments for acute short-term pain crisis are pain-killing medicines and fluids given either by mouth or through a vein to prevent dehydration. And the pain-killing medicines most often used are acetaminophen, acetaminophen, non-steroidal anti-inflammatory drugs, NSAIDs, and narcotics such as meperidine, morphine, oxycodone, and others. The treatment of patients who have mild to moderate pain usually begins with NSAIDs or acetaminophen. If pain continues, a narcotic may be added. Moderate to severe pain is often treated with narcotics. The narcotic may be used alone or together with NSAIDs or acetaminophen. Narcotic abuse and addiction are pain management issues that must be considered in any pain control plan. A medicine called hydroxyurea may be given to adults and older adolescents with severe sickle cell anemia to reduce their number of painful crises. The medicine is used only to prevent these crises, not to treat them when they occur. Given daily, hydroxyurea can reduce the frequency of painful crises and of the acute chest syndrome. People taking the medicine also may need fewer blood transfusions. People taking this drug must be watched carefully because the medicine can cause serious side effects, including an increased risk of dangerous infections. Some evidence suggests that long-term use of hydroxyurea can cause tumors or leukemia. Because of these risks, the medicine is usually only used in adults and older teenagers with severe sickle cell anemia. Although hydroxyurea is being tested in infants and children at this time, it won't be approved for use in children until its long-term effects can be more closely studied. A few new treatments are bone marrow transplants, gene therapy. Some new medicine is butyric acid. This is a food additive that may increase normal hemoglobin in the blood. Clotrimazole. This is used now to treat fungus infections. This medicine helps prevent the loss of water from a red blood cell and can keep the cell from turning into a sickle cell. Nitric oxide. This may make sickle cells less sticky and keep blood vessels open. People with sickle cell anemia have low levels of nitric acid in their blood. Prevention. Identify what can trigger the crisis, such as stress. Avoid extremes of heat and cold weather. Don't travel airplane that is not cabin pressurized. Maintain healthy living habits. Eat healthy. Avoid dehydration. Exercise regularly. Get enough sleep, rest, and avoid alcohol and don't smoke. Regular medical checkups and treatment are important. So that was my presentation. I hope you all enjoyed, and thank you. See y'all next time.